enter the room.
Hello, I'm Dr. Eamon, one of the doctors here in the GP surgery today. Can I please know your full name and age?
Hi, doctor. My name is Samantha Collins, and I'm 14.
Okay, hi Samantha, nice to meet you. How can I help you today?
It's a little embarrassing, doctor. But I'm actually here for one of those morning after pills.
Okay, I understand, Samantha. It's okay. There's nothing to be embarrassed about, all right? We're all here to help you. So it's okay. You can relax and be comfortable, all right?
Okay, sure.
Okay. I'm sure I'll be able to help you with that. But before that, I would need to ask you a few questions. Okay. Why do you need the morning after pill, Samantha?
Actually, my boyfriend Marcus and I kind of had unprotected sex last night, and I'm really worried about getting pregnant. You know, I've never
All
used it before, so I just want to give it a try.
All right. I see, Samantha. So, you mentioned your boyfriend and you had unprotected sex. So, is this the first time?
The unprotected sex,
Yeah.
yes. Otherwise,
Okay.
we use, condoms, but he doesn't seem to like it.
Okay. So, Samantha, since you are wanting this pill, I would like to ask you a few questions regarding your sexual health. I hope that's fine.
Can I guess?
Okay. Thank you. So, can you please tell me, since how long have you been sexually active for?
Um, like 2 months.
All right. And are you in a stable relationship?
Yeah, Marcus and I have been going out for like
Okay.
6 months now.
Oh, that's good to know. And where did you meet Marcus? What does he do?
He's in my school.
Okay, in your class?
Oh no, he's 15. He's 1 year elder to me.
All right. And and are your parents aware about your relationship?
No, not really. They don't really approve of Marcus.
Okay. Have you tried telling them about it?
No, not really. They don't really approve of any guys. They're very Catholic.
Okay. All right. So what do you think they might say if you confide in them?
I just feel, since they are like really strict Roman Catholics, their belief does not really align with, you know.
All right. Okay, I understand. Okay, and have you talked about this to somebody else?
My friends, no.
Mm-hmm.
Yeah,
Okay. All right. Okay. That's okay. And okay, talking about your period. So, are your periods regular?
yeah, I guess so.
Okay. Any problems during in between periods or with your bleeding?
No.
Okay. All right. That's good to know. And regarding your overall health, do you have any long-term medical condition?
No, not really.
Okay. And currently, are you having any discharge from your front passage?
No, doctor.
Right. Okay. Any burning sensation while peeing?
No,
Okay. Are you taking any long-term medications for anything, any over-the-counter medications?
no, doctor.
Okay. Samantha, and any allergies from any medication?
Not so far.
Okay. That's good to know. And talking about your, habits and lifestyle a bit, I know you're just 14, but do you drink by any chance?
Oh no.
Okay. And how about smoking?
Oh no, my parents would die.
All right. Uh, that's that's good to know that you don't smoke, Samantha. All right. So thank you so much for answering all of my questions. So you are here to further a morning after pill, Samantha. I can definitely give that to you, but I would give it to you, but I would like you to have it in front of me with a glass of water. Would that be fine?
Sure. Yeah.
Okay. All right, thank you. And apart from that, Samantha, there are a few important things that I would like to talk to you about. Since you mentioned that you are in a relationship with your with a guy in your school who is 1 year ahead, I would really encourage you. And since you are in a sexual relationship with him, I would really encourage you to involve your parents. I know you are saying that they might not understand, but you can try talking to them. What do you think about that?
Oh no, doctor. Yeah, I don't think that's a good idea.
Okay, okay. And if what do you think that if if he don't give you the pill today, do you think you would continue having this relationship and unprotected sex?
I mean, yes, I love him.
I understand. So what do you think might, happen if you continue having unprotected sexual intercourse?
I don't know, I might get pregnant. I mean, that's why I'm here.
Mm-hmm. And if you're denied the pill today, what would you do, Samantha?
I'm not sure, doctor.
Mm,
2 minutes
okay.
remaining.
All right, I see. Um,
It's
so,
really out.
sorry, I didn't get you.
I was really hoping you could help me out with this.
Yeah. Yes, Samantha, I'm here to help you. But like I said, it's always better to, involve your parents. If you think that they might not understand when you tell them yourselves, you can, arrange an appointment with us, with them, and we can all talk about it together. And if you think, talking to them would help, we are more than happy to do that. What do
Yeah,
you think?
I don't think that will help, doctor.
Okay. All right, Samantha. How about any siblings? Do you have any siblings?
No, I'm the only child.
All right. All right. Anybody close, anybody in your family who you can share and maybe they can try and talking to your parents about it? Anything like that?
I really don't want to talk to my parents, doctor. I mean, I'm taking this decision on my own. I want to be with Marcus. They will not understand.
I understand. Samantha, at this age, it might seem like our parents don't understand us, don't get it. But, at some point, they were our age too. So, at some point or the other, they have gone through this. It might not seem to us because they are our parents and we have never seen them young. But
Yeah,
trust me,
ready. Am I going to get the
sorry.
pill? Will you give
So, Samantha. Okay, Samantha, exactly. Yeah. Like told you, I mentioned to you, I will be giving you this pill. And but I would like to tell you that sometimes this is not necessary that this pill is 100% effective. So I would strongly advise you to please use the condoms. Moreover, taking the pill won't protect you against the sexually transmitted infection. So for that, it's really important that you guys
Move on to the next station.
awesome, doctor.
Thank you.
I mean, towards the end, I think you were asking a lot of those questions about informing your
Yeah,
parents. Take up a lot.
yeah,
See, now you have a lot more to talk about, right?
exactly. I just remembered that I had to talk about the barrier method and everything.
Yeah,
Uh,
long-term contraception options that you
exactly.
can screening, right? Leaflets,
Yeah,
pamphlets, up, right? Any safety netting, what happens if you happen to, vomit after a few
vomit and tummy pain.
things, right?
Yeah, yes, you're right.
It's good to actually, nudge them towards, talking to their parents. But
Mm,
understand, in these cases, they will just say no, flat out.
okay.
Ask in different ways. Definitely, that was good. But if you're understanding the fact that she is very reluctant, then start talking about other aspects because you have a lot more aspects to cover here, right?
Okay.
So that means
Yeah.
you've gathered the history, you've done the Gaelic competence Fraser criteria there.
Mm-hmm.
Yeah, so that was good. That was good. Good job. All right. So, anything that you guys think Dr. Maha must have missed? I mean, I think that was a great consultation, but any opinions from the crowd? Anything that she might have missed? Anything that's important? Yes, Dr. Vigdan, go ahead.
Hi. I think she didn't miss anything because she asked about like the age of the boyfriend as well. So
Mm-hmm.
that was also covered. And she tried to counsel her as well. So that was also covered. And
Right.
like I think she did a great job.
That's great.
Thank you.
That's great. And Dr. Ranmali, do you have any opinions? Yes, go ahead.
Yeah, I think in the menstrual history, she could have asked about the last menstrual, last menstrual date, and
Yes,
also
okay.
about the previous contraceptive methods. I think she mentioned about not wanting condoms, but
Mm-hmm.
about her, and also what she understands about long-term contraception and also the STIs. That's all I. But
Yeah,
otherwise,
yeah,
good
yeah.
job. Yeah.
Right.
Yes,
Awesome,
exactly.
awesome,
Like,
guys. But one thing I need to tell you guys, that even when the partner is of their age, you need to still ask a certain question, a certain number of questions for safeguarding and to understand coercion. You need to
mm-hmm.
understand this relationship. Was it something that she was forced into? Was it something that she wanted? That's a very important history. Was she forced? Was
Right.
she told? That is an important question, no matter the age of the
Mm-hmm.
partner. You need to understand is this was, from her volition, it was something that she decided, right? So
Right, right.
definitely when it comes to teenagers, you have to ask a certain number of questions to gauge the idea of their relationship, you know. So the age of the partner matters to see if they are in any position of power and to understand was this something that was, forced upon them, right? That is a very important question that you need to ask, no matter the age, right? So I would say we got a lot of good important points. LMP is also very important, right? So
Mm-hmm.
definitely that is also an important question. And yes, so when you're actually asking, so at a point, when do you offer the pills? Like at what point after knowing what would you offer the pills? In that entire consultation, when would you be offering the pills?
Yeah, actually, I should offer it after doing the Gilix and Frasers, and if she said that I will continue, then I would offer her. I think.
Absolutely. Even you understood that you're right. So only after understanding the Gaelic competence and asking the Fraser criteria, then go ahead and offer the pills. Then only should you be actually offered, right? Because at one point you went, I'll offer you the
Yeah, yeah,
pills. On what basis are you offering the pills? You need to understand that fact, right?
yeah,
So those
right.
questions of what do you think this means, the relationship, having a relationship without, using any contraception, right? And what is their understanding about condoms? That's also very important. Like, what do you understand by using condoms? So she thinks that, they are uncomfortable. What else can condoms help with? Preventing STIs. That's a very big, major thing, right? That you need to communicate to them, right? That please continue to use them because they actually help you prevent STIs, right? Even though you have an additional contraception, but this gives you an additional protection that you need to be aware of, isn't it? So before you even give these information, you need to gauge their understanding. So you need to understand how much they understand about these things, right? So understand about unprotected sex, understand about the contraception. How do you think they work? Hey, you want these pills? How do you think they work? Just get an idea about it. Ask them to inform their parents what will happen if I don't give you the pills today. After you offered me the pills, you're telling me that you wouldn't.
Yes, exactly. I made that mistake. I just offered it early on. Yeah,
Yeah,
and then I remembered that there was a lot to do before that.
absolutely. You need to understand the competence first and then offer the pills. Because if they are not competent, you will not be offering the pills. You will be safeguarding them. Right. So if you feel that they are very irresponsible with the way they're going to be using these pills, you're going to be informing their parents. Because taking these pills like, candy, that is itself a risk factor for, DVT and whatnot. Right. So you
Right,
can't just be
right.
offering these kind of pills. Yes, Dr. Patience, you have a question?
Yes, thank you. You said if they're not competent, it means I'll have to safeguard them. How do you safeguard them?
So a couple of things you need to understand about competency. You need to understand how they're going to be taking the pills, right? You need to understand that these pills also have their side effects, right? You can't just be taking them whenever you want, every time you have sex. It's not like you can just continue taking them, right? So you need to first talk about the long-term contraception also, and make sure that they understand. And if it is something that they are not understanding, tell them the safeguarding. So when you're giving confidentiality in the beginning, when you're giving that, you can always pull this in, when you feel that they are not heading towards, they're not going to be following what you're going to advise them. What they are going to do is going to be absolutely reckless. So at a point where you feel they're going to get reckless with the medication you're going to offer them, that's going to be on you. Remember that, because you're the one who prescribed the medication. So bring in the fact that whatever we discuss today will be between you and I until there is no immediate danger to anyone, right? Definitely drop that as soon as you feel that these people, anybody is being reckless, right? And if you understand the fact that they are not going to be using them responsibly, then do not offer the pills. Only after doing the Gillick competence will you be able to understand what they think these pills do, what are the side effects of these pills, how to exactly take it. After explaining to them how to take it, you need to ask them to repeat it so that you understand that they've understood. The only way you can understand if they have understood is by asking them to repeat it to you. That way you can gauge how much they understood. By just asking them, did you understand, is not the definitive way. By telling them to repeat what they understand is when you definitively know that they've understood, right? And from that understanding, if you feel that it's not going to be used responsibly, then you cannot offer the pills. All right, that's also going to be on you, unfortunately. So at a point where you feel that they are not going to be responsible about using the pills, then don't offer it altogether. And you have to document these things. That's one important point you missed, Dr. Maha. Documentation is of the utmost importance when it comes to these cases. You have to document that you have checked their Gillick competence, and you have to document the fact that you've asked the safeguarding questions, you have mentioned to them the long-term contraception options as well. So every basically most of the conversation has to be documented. So mention the fact that I'm going to be documenting this, because there is another case where a mother comes asking the GP that you've prescribed my daughter's contraceptive pills. What were you thinking? So that's when you have to explain everything that you do in the consultation of, when you're prescribing these the underage girls pills, right? So you have to tell them all the precautions you take beforehand. Only after understanding that they're going to be using the pills responsibly, then only we offer them, after asking a series of questions and understanding, that they understood what we are trying to explain to them. Do you understand? So
yes, I do. So in the case that I've assessed that they cannot have medication, they're not Gillick competent, and I've documented, what's next for them? Do they just go on without the medication? Do they, how do they, because they still need the morning after pill. So
you
how
have
are they
to
given?
escalate the situation, doctor. You have to just escalate the situation. That is something that will not be in the scope of your, something that
Okay, good. Oh, yes. All right.
when
Thank
you
you.
handle the situation, always escalate the situation, right? Or do not give medication if you feel they are not competent, and escalate the situation immediately. So you understand? So, and then there will be
Yes.
steps that will be taken for that. But from your side, you can't be irresponsibly giving them the medication. That's very important. All right. So I hope you guys were able to understand this. This is a very interesting case. I know all these Gillick competence and the contraception for young are one of the most challenging cases out there. Yes, Dr. Wanjiku.
Wanjiko, thank you. Please clarify what you are saying we need to ask the patient to repeat. I didn't quite get that.
Oh, once you explain to them how a medication works, what would be, at one point you would be asking them these questions, how do you think, this medication works? what do you think are the possible side effects? This is when you're doing the Gillick competence, you will be asking these questions like, from what kind of understanding are you asking for this medication, right? So once they actually, either they give you some answer or they say, I don't really know, I've only heard about this. Then later on, after you explain to them all of this, you need to gauge whether they've understood, right? If I'm going to be giving you this medication, this is how it works. And, you might be experiencing these kind of discomfort. And, these are usually the side effects that you will be experiencing. And just in case if you feel that, your periods have been late, make sure to do a pregnancy test, just so that, no unwanted pregnancies arise from that, right? And basically give all the instructions and then ask them, could you please explain to me what you understood about this medication, on how it works, what are the side effects, what are the things that you need to take care of if I can give you this medication, right? Ask them to repeat that part, because they have to, that's the only way you can understand that they understood, right? In the real exam, you might not really get that much time to do everything, but you can always say that I'm going to ask you a few questions to understand how much you've understood. You can put in that line, in the management section, so that the examiner also knows that you will be gauging their understanding. This is the best way to gauge an understanding, by asking them to repeat what they understood. Yeah, does that clear it out?
Yes, thank you.
Awesome. All right. How about we give this another try? But before that, I would like to go through the yes, Dr. Ranmali, will go through the results as well.
Yeah, I'm sorry, quick question. When 14-year like young people come, when we start the consultation, do we have to tell that ideally we would like to have your parents with you, something like that? Do you have to say something like that?
I mean, it comes within the part of the Gillick competence itself, like, why unnecessarily make them uncomfortable right at the get-go? Let them express themselves on why they are there. And then, when you go into the conversation, you can actually ask about, are your parents aware about this? Right? Because it's not like you're not going to be seeing them if they are not accompanied by their parents. Even if they are not accompanied by the parents, you want to understand their concern. So let them freely first talk to you. And then you can, inquire if their parents are aware. Are they comfortable if their parents could also be involved? So that way you're giving them autonomy and they are also respecting their wishes.
Okay, right. Thank you.
And along with that, encouraging them to involve their parents.
Yeah. Okay. Thanks.
Awesome. Let's quickly look at that. So you guys can see the thing. All right. So greet the patient, confirm full name and age. Good job on that. Ensure privacy and confidentiality by explicitly stating everything we discuss stays between us unless I feel you are at risk. That might be an important thing to mention, especially when the contraception gets, when they actually start talking about contraception. Because at that time itself, that, you can't keep it confidential if you feel there is a, risk to her life or her well-being, right? So that is a good line to bring in, especially when you know that this could be a case that might need involvement of others, right? Does that make sense? All right.
Yeah.
Right. Ask directly what brings you in today. Confirm the primary reason for the visit, request for emergency contraception, clarify timing and context of unprotected sex. This was important because you need to understand when did they have it. So which one would be the most applicable contraception? There are some contraceptions that give you protection for 42 hours. There are some that give you 72 hours. Right. So the timing of the, the intercourse is very important. All right. Ask about the sexual history, previous sexual partners, and history of STI testing. Clarify. Yes, you asked about, do you have any problems, any discharge or any burning sensations? That was a good question. But you can always ask, have you been diagnosed with any, STIs in the past? You can go directly with that. and also the other symptoms also, if she doesn't actually know what, involved in having an STI. Right, clarify details about the unprotected sexual intercourse and if any contraception is usually used. Ask about the age of her partner and whether the relationship is consensual and free from pressure. Assess for safeguarding concerns like coercion, grooming, or abuse, right? Explore the patient's understanding of contraception and sexual history. This is very important. You never really got to the point of understanding what she knows about this. With what understanding is she asking for these pills, right? Assess her understanding for the emergency. Ask how she thinks it works, when should it be taken, and side effects, right? Explore menstrual history in detail, cycle length, last menstrual period, any irregularities. Yeah, LMP was an important question there, because mainly your most important question amongst the sexual history is the LMP, right? And since you will be giving the emergency contraception, she might be experiencing some spotting. So that is something that you can talk about when you're giving the medication, to understand that initially there is no irregularities, but you might be experiencing some because of the medication, right? Ask if she understands the advice, would continue having sex with or without the contraception, and her willingness to involve parents. Yes. Ask about past medical history, STI, allergies, any current medications. That's good. Check understanding throughout the consultation by using teach back, such as, can you please tell me what you have understood so far? Right, those are important questions, and give it extra. This is an important one. All right, so explain that she's at a risk of pregnancy, and with the window of the emergency contraception, offer the pills by saying, since you've understood how it works and we've had a good discussion, I can offer you the emergency contraception pill today if you're comfortable with that, right? Offer emergency contraception pill, emphasize urgency, most effective within 24 hours. The effectiveness kind of reduces with time. Discuss the side effects, nausea, vomiting, spotting, irregular menstrual changes, and what to do if vomiting occurs within 2 hours. That's important. Discuss limitations of emergency contraception pill and the necessity for long-term solution. Explain the emergency contraception is not a regular method. Let's explore options for long-term contraceptions. Offer long-term contraception options such as COC, POPs, implants, IUD, and discuss suitability and benefits, right? So you can say that there are long-term contraception such as this. How about we set up a follow-up and we can talk about these options in more detail. Yeah, so because at this point, since you're giving her the emergency one, all right, I want to ask you guys, so instead of giving the emergency one, what if you offer a COCP? Will that be effective? Anybody? All right, so usually they take effect only after 2 days, right? So that is something that will not be appropriate for an immediate contraception. So yeah, so hence you'll be giving them emergency ones right now, and for long term, you will actually be wanting to discuss long-term options, right? Discuss STI risk and offer STI screen. Explain that emergency contraception does not protect them from infections. Advise consistent condom use and educate on dual protection from pregnancy and STIs. Encourage follow-up in a month or maybe even sooner, right? Because yeah, for the long term, to review contraception needs and emotional well-being. Provide written information, emergency contraception leaflets, local sexual health clinic, contact, STI screen pamphlets, right? Document Fraser criteria, assessment, discussion on safeguarding, contraception advice, and management plan. So documentation is very important in these cases. Safety netting, the condition, safety net the condition and possible complications. Warn the next period may be early or late, and that a pregnancy test should be done if more than 7 days has passed, if she's like 7 days late, right? All right, interpersonal skills, validate the patient's feelings and concerns about her relationship, and parental reactions. I think I'd give you yes on that. So, yeah. Use body language and active listening to build trust. That was very good. At no point did you interrupt me. That was very good. That's essential in conversations, right? Reassure the patient of your support and confidentiality is an important point. Provide clear, non-judgmental information on emergency contraception and its use. Educate on the need for regular contraception and safe sexual practices. Address any of the patient's misconceptions or fears. Right, so that is, you can only understand that only if you ask her the question of what you think. How do you think what's going to happen? How do you think this works? What happens if I don't give it to you? Right. I would give you a partial on that one. Be sensitive on the cultural background and the mother's religious beliefs. Right. So yeah, you can just say I can understand where you're coming from, and I completely respect that. She said, oh, she's like completely strict and all. Respect the patient's autonomy while guiding her. So the examiners marked you no for that, but I'll give you a partial because you kept asking me on the point that do you want to involve somebody? Do you want to involve somebody? I was definitely move on. Next point.
Okay.
Sometimes the simulators might do that, especially when you're going a little off context. They may lead towards, getting back on track. Sometimes they may actually give you a comment or remark like that. So don't think much of it. Just get back on, ask another question, continue asking your questions that are important. Don't try to do these things. What's the case? So Dr. Farhan is asking what's the case. This is basically, teenage contraception, underage contraception, basically, right? Yeah, so at that time, some people, if they say something strongly, especially when they haven't like in cases of alcohol and smoking history, sometimes without signposting, if some people ask questions, there might be some simulators that might go a little off script and say, how could you ask me that? I've come for some concern and you're just asking me about my smoking and drinking habits. How does that matter to you, doctor? So, some people might take a lot of time to justify it, saying, you see, I have to ask all these questions because it's important for me to know. I don't mean to offend you. You can just deal with that particular thing in a short line. Say that I'm extremely sorry to make you feel uncomfortable. It's just certain questions that I have to ask to get a better idea about your health. Just small question. Or even, when you start feeling uncomfortable, a lot of people end up over justifying of why they asked that question. So try to, just give a short reply and move on to another question, right? I hope that kind of made sense. All right, finally, reassure confidentiality until there is no danger to anyone involved, and offer support while gently encouraging involvement of a trusted adult. Yeah, awesome. So a little off on consultation. Yes, you offered the thing very early. I would say you offered medications very early.
Yeah, exactly.
So yeah, you definitely want to pay attention to that. All right.
Please like and subscribe to Turing Med School. Good luck with your preparation.